Carson Wentz, quarterback for the Colts. As you guys have been reading, it's kind of what I'm reading inside the media seems not quite enough information. So I'm going to speculate on what happened to his foot, what I think probably has happened to his foot. I think what has happened with Carson Wentz, because they've described this as an injury that happened probably in high school that he didn't even know about. So it was an injury that happened, obviously didn't get operated on, but it sounds like it healed. He's been doing okay, right? So what I think most likely happened, because they're talking about the fifth metatarsal, and by metatarsal they're talking about the bones in the foot before the toes, right? So this would be in your, I guess you can look at it as the mid part of your foot, the top of your foot, right? So these are the metatarsal bones. Okay, there's 1, 2, 3, 4, 5 on the small, that lines up with the small toe, right? At the base of the fifth metatarsal is a really common place for people to get fractures. There's different types of fractures. There's an avulsion fracture, and there's fractures that happen a little further down the bone. One of the most talked about ones that happens in athletes is called a Jones fracture, right? So that fracture happens right here, okay? Now, for people who are not really athletes, if that fracture hasn't moved that much, you can put them in a cast, have them not walk on it, and it'll heal, right? But there's a chance that it won't heal, right? Because of the blood flow to the area. In athletes, and especially elite athletes, those things are always operated on, right? And the reason is that they're going to put a lot more stress on that. There's a much higher chance that with all that motion, it's the foot's always moving around, going on uneven surfaces, and if you're an athlete, you're putting a lot of stress on that foot, there's a higher chance of that bone not healing, right? Or if it does heal, getting what they call a pseudoarthrosis, a non-union. The bone fills up with a bunch of, the gap in the bone fills up with a bunch of fibrous tissue, not really bone. It's enough to hold it together, but that can be problematic later. So I think that's probably what happened to Carson. He had a Jones fracture, was not treated. It went on to form a pseudoarthrosis or a non-union, so a bunch of fibrous tissue. It's holding the bone together. That was good enough until at some point that fibrous non-union, which is the weak spot, that pseudoarthrosis, the weak spot, broke, right? And that's why he's having pain. So I think what's being said when they removed bone is that they removed that fibrous tissue, the pseudoarthrosis. They probably put in some bone graft, in other words, some bone cells that have been ground, some bone's been ground up, has bone cells and so forth, into that gap. And then they put a screw that holds that bone together. So the screw goes from here into the bone, tighten it down, and it's a lag screw, so it sucks that bone together, puts compression across it, and the bone will heal. The other possibility is he had what's called an avulsion fracture, right? So it'd be the same bone, the fifth metatarsal, and the tendon that attaches there is called the peroneus, just more than one peroneus, but I'll just say peroneal tendon attaches here, right? So that tendon attaches to the bone here, and an avulsion fracture is when there's such force on that it pulls away a little fleck of bone with the tendon, right? Now, that also can heal and form a pseudoarthrosis or a non-union, and it's functional, but it can become painful or reavulse. Remember, that's fibrous tissue again, so it can pop off again. So if the reports of them saying is that they're removing a piece of bone that dislodged, then that's maybe what exactly happened here. They may be removing that fleck of bone that's attached to the tendon, reattaching that tendon to the bone with an absorbable screw or some sort of an anchor and suture that's going to hold it to the bone. In which case, he still needs to be immobilized until that's healed, and then get back to playing. So the reports that he was seen at training camp, standing, moving around. I think it's probably okay to bear weight either way, whether you've had the avulsion repaired or the Jones fracture repaired with a screw that's going, an intramedullary screw going to the bone. You can weight bear. I still think it needs to be protected, and we'll see how he does. But fifth metatarsal fracture, either an avulsion fracture or a Jones fracture, that they had to take down the non-union, put a screw, or the avulsion fracture where they had to take out that fleck of bone and attach the tendon back to the bone. He's going to do fine.